and welcome. In today's show, we are going to talk about animal innovative therapies. Did you hear about ictio therapy, hydrotherapy, and larval therapy? These three alternative therapies have been used by experts around our country nowadays. Now, to introduce us in what those therapies are all about, and please, let's have a welcome to our guests over tonight.
Thank you.
Thanks for coming. Take a seat.
Thank you.
Thanks. Welcome. Have a seat.
Hello.
Please.
Hello.
How are you today?
Fine.
Thanks for joining us in our talk show for today.
Thanks for you. Thanks for you.
A photo? Are with us today Dr. Gilmore, Dobson, and Slater. We are going to start with you, Dr. Dobson. You are an excellent beautician and dermatologist who practice ictio-therapy. Welcome. Tell us about the therapy.
Okay, thank you, Nancy. This therapy is carried out with the help of small fish originating in Turkey. These fish have no teeth, they just have a small mouth that sucks the impurities and dead skin.
Good. Sounds awesome.
This treatment consists of putting your feet in warm water with the fish, of course, and they immediately start doing their job.
Oh.
And you feel a slight tingling sensation.
It sounds nice.
Yeah, it's relaxing too.
2 appointments for me too. Okay, thanks. And with, how you got the ictio back in your professional career?
Well, I got the ictio in a travel business. I learned how to do this. Now I'm more expert about this therapy.
Nice. Okay, with us is also Dr. Slater,
Hello.
an expert in larval therapy who studied veterinary at the University of London.
Yes, it's correct information.
Welcome, Data.
Hello. Hello, Nancy. Thanks for your invitation to your program.
You're welcome. Tell us about it. Introduce us.
Okay, the larval therapy, it's a kind of therapy so old, an ancient man. Well, it's ancient because they had been used for the treatment of wounds. It's a treatment for wounds, larvae, and it made for several of hundreds and hundreds of years.
Oh my goodness.
Yes. At the beginning, the Mayan civilization treat their wounds with that therapy.
Really?
Yeah. And the Australian Aborigines use that kind of therapies too.
Doctor, tell us more about what the treatments and therapy consist.
Well, that kind of treatment consists to treat a wide spectrum of wounds, not only when you cut off with a knife. It's good to treat burns, to treat wounds in case of amputations, and especially for wounds caused by ulcers, in like the case of patient with diabetes disease.
Okay.
Yeah.
Okay, I see. Doctor, tell us more about the treatment and therapy consist.
Well, the larval therapy, it's a kind of larva from the flies. Do you know the flies?
Oh yeah?
Well, the larva of the flies, don't worry, it's sterilized by scientists.
Oh, it's not sounds good for me.
It's sterilized, don't worry. Nowadays it's treated in hospitals, clinics, and laboratories.
Dog therapy seems a little unpleasant and a little disgusting. At least for me, I don't know. What kind of...
Is with us Dr. Gilmore, the award-winning surgeon in alternative medicine in 2009, specialist in hair growth therapy. Welcome, doctor.
Hi, Nancy. It's a pleasure to be here today in your show.
Thank you.
Absolutely convinced that, well, first, leeches are not beautiful enough. I know they are a little disgusting.
Oh, poor leeches.
But they help us a lot. They save many lives a day.
Oh, yes?
And they are a good tool for surgeons when they are in surgery.
Oh.
Actually, records indicate that leeches were used in Egypt and Greece, but became more popular during Middle Age. It was the main method for bloodletting or purification. Doctors prescribed this treatment for a variety of conditions, since headache to fevers. But at the end of 19th century, this treatment was increasingly called in question.
Oh.
But in 1970s, this treatment re-emerged to help in plastic, reconstructive, and trauma surgery.
Oh, good.
It's an in-thing treatment.
Yes.
Oh, good. Sounds good.
Very good.
Yeah. Could you please explain more about the treatment and the therapy consists?
Yes. Well, nowadays this treatment is used to treat congestion venous, to relieve vascularly compromised plaques, and also to salvage tissue that has been surgically reattached after traumatic amputations. The treatment consists that leeches are two ends, two suckers at both ends.
Okay.
I'm sorry. The leeches are put in the tissue, and they suck bad blood.
Oh no!
Blood clots in all your body.
In all your body?
They work in all your body.
Even the eyes,
Even eyes, feet, legs.
Every part of the body.
Every part of the body.
Okay, I understand. Okay, doctors. Do you all have a scientific studies, right?
Yes.
And does the National Commission of Health agree with your clinical treatments? Or in this way, do they draw some lines for you?
In my case, not to my knowledge. But if you ask me, I'm thinking about to suggest that larval therapy to suggest to the National Commission of Health as a project for alternative medicine, and of course to be certificated in the future.
Well, good, okay.
In my case, my treatment is certificated by National Commission of Health, and also
Nice.
helps a lot of life. It's a good tool for surgeons in surgeries without chemicals, only natural. I don't know.
Okay, the idea is clear now. And what about you, Dr. Dawson? You're always keen on these animal therapies, don't you? Is there something else do you want to say?
Yeah, I'm always keen on because since discovered this therapy, I'm obsessed with this.
Oh, yeah?
Yeah, I love it. It's very good and relaxing.
And which of these therapies is better at showing their points across? I mean, which therapy do you sympathize with more? And why, Dr. Dawson?
Nancy, are you kidding me?
Oh?
I'm sorry, but I'm afraid of anyone.
What?
Because both are disgusting.
I
I'm
can't
sorry,
I
but
can't hear
that's
about
true.
this. I can't believe it. I can't believe it.
I came here to talk about glutation, feed, exfoliating
Oh,
foods,
no,
no
I can't-
issues and larvae. No,
I can't
really
think for a minute
No,
that This happened to
That's
me
I'm
too now.
sorry, but that's my opinion.
Oh.
My treatment is certificated by
But
National
it's
Commission of
disgusting.
Health.
Both.
You sir, hey,
No, the mind.
hold on. Wait a minute. We came here to this program to talk about therapy.
I don't want to hear
therapy. It's
Even
not an issue for health.
Even I couldn't
I don't know.
show it to
Oh,
public
no.
my feet, my
Oh,
foot.
You do it here.
Okay.
Well, that's another.
I'm sorry,
No, when
but
it's a public
I-
conversation,
Oh,
okay.
Bye.
Come on, don't lose your temper. Come on.
Uh-oh.
Oh, no.
Okay.
Happen. Well, ladies and gentlemen, it's time to say goodbye. And thank you, doctors, for joining us tonight. And thank you, you too, for watching us. I hope that you have well informed. And see you next week. Bye.